Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Acidity. What is acidity? Acidity is one of the commonest ailments which each of us must suffer from sometime in our life. It's a medical condition produced due to excessive production of hydrochloric acid in stomach, which flows back into the food pipe or esophagus, causing burning sensation and pain in lower chest region. Some facts about the disease. Commonly seen in adults over 25 years of age. Gender mostly affected, both women and men. Body parts affected, esophagus, stomach, duodenum. Similar conditions, GERD, gastroesophageal reflux disease. Gastroesophageal reflux disease, there is some sort of acidity, same thing. Peptic ulcer, same. Gastritis, same. Dyspepsia, almost similar meaning. Prevalence, in India it is about 18% of population are affected, in world about 12%, sorry. India 18%, all over world 12%. This was, statistics was taken from, in case of India 2018, in case of world 2005. Mortality, almost negligible. This is the picture where the gases are just rising up from stomach towards gullets or esophagus. What are the common symptoms of acidity? Heartburn, sour taste in mouth, regurgitation, sore throat, difficulty in swallowing, nausea, vomiting, malaise, indigestion, weight loss. This is chronic effect. Chronic effect is weight loss. Due to acidity, there may be severe malnutrition leading to weight loss. Reverse is also possible. Reverse is also possible. In case of acidity, sometimes huge fatty person, I mean over obese person is also suffering from acidity. It is also possible. What are causes of acidity? Food diet problem like rich foods, highly spiced, fried, fatty foods. Low fiber diet, intake of stale foods, unhealthy habits like excessive intake of salt, overeating, irregular eating, lying down just after eating, eating before strenuous exercises, erroneous habit of drinking water, etc. Excessive intake of caffeine like tea, coffee, chocolate, etc. Smoking, lack of physical activity, and loss of sleep. What are complications of acidity? Medical conditions like diabetes, celiac disease, connective tissue disorder, hiatal hernia, special type of hernia, obesity and overweight. How can acidity be prevented? Few suggestions. List is not exclusive but inclusive. That is, this list is not final. Avoid all sorts of addictions. Do not lie down just after eating. Avoid trigger foods. Trigger foods means the foods which, in your particular case, starts acidity problem. Take care of medicine you used to take regularly. A lot of person takes medicine regularly. If that medicine causes acidity, then that is a very difficult thing to tackle. You have to consult your doctor. Minimize taking alcohol. Try to take several small meals a day, in spite of huge meals. 2. Keep body weight under control. Body mass index between 18.5 and 24.9 is a good marker in this regard. On the right hand side above, here I have given a formula for BMI, body mass index, equal to weight in kg divided by height in meter square. Weight in kg divided by height in meter 2 times into mean square. If you divide this and the result you compare, if it is large, say the example is given, say weight 65 kg, height 1.7, then BMI equal to 65 by 1.7, 1.7 divided by 22.4. Okay, because this lies within this range. If BMI lies within this range, then it is a good marker. Absolute body weight sometimes doesn't give any good representation of body state. Wear loose garments. Do not work out just after eating meal. Relax yourself, eat slowly and enjoyingly. Take carbonated drinks sparingly. Now discussion about treatment of acidity in homeopathic medicines. Brownia for acidity. Feeling as if a huge stone on abdomen. Pain felt between shoulders. Bilious vomiting. Tongue whitish. Lying still in dark room gives temporary relief. Use 12 or 30, 6 hourly. Calculate carb for acidity. Patients have craving for indigestible things like chalk, charcoal, and also for eggs, sweets, etc. Milk intolerable. Frequent shower eructation, shower vomiting, loss of appetite, loud belching. Give calculate carb 6, 3 hourly. These are mainly acute conditions. If you want to give it for chronic cases, it must be given in higher potency and minimum doses. Lycopodium for acidity. Befitting for old person with yellow skin and suffering from liver and kidney. Worsening of all symptoms from 4 to 8 p.m. Like food and drinks warm. Best adapted to person intellectually keen but physically weak. Afraid to be alone. Give 1 dose each for 2 consecutive morning empty stomach for chronic cases. Lycopodium is a very good medicine for chronic cases of acidity. Carbo-veg for acidity. Acidity with huge eructations. Abdomen heavy, full. Temporary relief from eructations. Nausea in morning. Feeling sleepy. Feeling better on lying down. Feeling better on lying down. This for better for subacute cases. Give 30, 3 hourly, 4 doses. Sulfur for acidity. Either complete loss or excessive longing for foods. Great desire for sweets. Milk disagrees. Bitter taste in mouth in the morning. Drink much, eat little. Give sulfur 38 hourly, 4 doses. In case of chronic cases, you can give also higher potency like 200, 1m, 10m. But doses should be minimum. Urgent nitricum for acidity. Great craving for sweets. Enormous distension. Belching with gastric complaints. You give argentum 30, 8 hourly. Rubinia for acidity. One of the specifics for hyperhydrochloria. Flatulent colic for children having acidic smell of body. Vomiters, stool, urine, every discharge from the body acidic. Give Rubinia 6 to early. Phosphorus for acidity. Hunger soon after eating. Sour taste, sour eructation after every meal. Huge belching. Post-operative gastric troubles. 30, 4 hourly, 4 doses. That is very important. Last point. Post-operative gastric trouble. You will get present. After operation, there is trouble in acidity and allopathic medicines are not giving proper result. Patient will come to you. Just think of phosphorus in that time. This is most important.